Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. My first question. In a previous statement, the ministry had mentioned that after a year of circulating, that the coronavirus has become more effective in spreading during this new surge. It has also become more lethal and deadlier, according to the statement. We just wanted you to explain that further, and then there is talk that the Brazilian variant is here in Guyana. Would you be able to clarify that?
Well, what we have seen with the coronavirus pandemic is that you've had several waves of the virus. Uh, Initially, when this started, you had a particular strain of virus that was circulating. And like with all coronaviruses, we have seen that the virus have started to mutate. In fact, some of the experts are predicting that every 2 weeks or so you see different mutations. A lot of those mutations do not really have any clinical significance, but some of them actually would have a greater impact on the trajectory of the disease. And so, over the period of time, we have seen cases go up, then it went down, and it go up again, and then it come down. In many parts of the world, you now have what is termed a third wave, and in the United States, I think they're talking about a fourth wave. So we have seen these ups and downs, and we really have to, when we notice that there's an uptick, we have to be very careful with how we are managing, what we can do, how we can further reduce the spread. In Guyana, over the last month or so, we've started seeing an uptick of more cases. And well, it's not in every region. We have seen those cases happening more in Region 4, in Region 3, and in Region 7. And out of seeing more cases, we have started seeing more hospitalization. So as of today, we right now have about 70 persons in hospitals. We have 54 at the Ocean View Hospital. We have persons at the Linden Hospital, West Demerara Hospital, and New Amsterdam Hospital. So our regional hospitals, we now have more COVID patients coming into them because they require assistance in breathing. And so we are seeing more cases coming to us. And out of those that have been hospitalized, a percentage of them are much sicker, and they will have to get ICU care. So right now at Ocean View, we have about 12 such patients. So we are seeing this, and we want to urge the public to take additional precaution, and that is why the ministry statement went out, because we've been seeing these cases going up, and we are encouraging people to, do all the public health measures that we have issued and take precautions, because we've seen a lot of people who are not abiding by the rules, not wearing masks, and so forth. And because of these breaches, you're going to continue to have spread. Now, as it pertains to what variant or variants we have in Guyana, we don't know, because while we would have sent 10 samples to CARFA for genetic sequencing, the results of those samples did not come back specifying that we have any of the newer variants. So we still don't know what variants we have in Guyana, and we can only know that if it's confirmed by genetic sequencing.
All right, but it brings me to that specific issue. Since those samples, have we been able to collect additional samples, and have we sent any at any particular time?
Well, we have samples because when we swab patients, whether for doing the PCR test and so forth, we are able to collect these samples. We are trying to work out arrangements where we can do the testing, but so far we haven't been able to get additional testing done. We are hoping that maybe we can do some more with CARFA, but those arrangements, we'll have to put them in place.
All right. Just for clarity, you said that they've noticed persons are getting sicker, but there is no indication as to what variant or if there is a variant.
Well, we can only know what variants are circulating if we do genetic sequencing. We know globally that um, from last year you had a variant that was discovered in the UK. I think it's the B117. You have a variant that was discovered in South Africa, and then you have the P1 variant in Brazil. Brazil also have recorded a P2 variant. So these variants are there circulating. In the United States, there are also about three or four other variants that have popped up. You have a California variant, you have something from New York now. Um, but again, it's hard to determine which one we have or if we have any because we don't have sequencing. And you will only know if you have sequencing. But what we can say based on our what we are seeing clinically is we are seeing more hospitalization. We are seeing when people come into the hospital that a percentage of those are getting sicker. So we are having a lot of cases in the ICU, and therefore we know that more people are being affected by this in a very uh, adverse way. We have also seen younger people also being affected, and that is quite worrying.
Right. I want to take you to the COVID measures, and I know that the task force would monitor events and so on. The question we want to ask is: would the task force be doing more checks in terms of public buildings, and then how can they also monitor homes, private homes?
Well, the task force, we depend on the public to sometimes report what is going on. Say if there are like private parties in people's homes and so, those things should be reported so that the task force can work along with the police and the joint services uh, to respond to those things. Again, the task force cannot be everywhere. We have limited resources, and while we want to use these measures as deterrent, people really have to start becoming more responsible because this thing everybody is involved in it. If you are if you're not following these rules, you're endangering people. At this time, in the midst of a pandemic, why is it that people still want to go out and have all these parties and it's not normal times, and therefore people really got to start taking these measures seriously. And if it's not absolutely necessary, don't go. And if you must go somewhere, then comply with the measures that we're putting out. Things like wearing masks, they actually work. Yet we find that people are not doing these things. And if you don't do them, then you're putting yourself at risk. So I don't know how much more we can keep emphasizing that. But it's really important that people start understanding the message that we are saying, and not just understanding the message, they have to change their behavior to make sure that they're taking these measures seriously. And then people can help us too, because if you see other people that are breaching these things, then talk to them. They might be your friend, they might be a family member. You have to talk to them and get everybody to start complying. Because if everybody start doing the right things and staying safe, then all of us would be safer. But if you have people who are taking risks and doing all kinds of other things, then we'll have the transmission of this virus circulating within our population. And, it poses a challenge, not just to the person, but the people living within that community and then the larger Guyanese community. And, different people react to the virus differently, and therefore we'll see a percentage of them getting hospitalized because they're sicker.
Okay, sir. I have one last question before we go. Yesterday, there was this hoax. Persons were talking about the curfew, the hours. I just wanted you to reemphasize what are the hours right now, and then for the if the infection rate continue to climb, would the task force consider adjusting the curfew if it comes to that?
So right now, the curfew hours are from 10:30 p.m. until 4 a.m. in the morning. Whether the task force would consider adjusting it, those things are always under consideration. In a discussion with task force members, you know, the last task force we had, there was a discussion, but we haven't um, changed anything as yet. If cases continue to rise, then we'll have to reevaluate the situation and we'll see what the appropriate measures are going to be. But as of now, those hours remain. Now, one thing that people have to understand, not because the thing says 10:30, that means that you have to be on the road until 10:30. If you have no business on the road, then go home early. There's nothing preventing you from being at home early, staying away from crowds. Don't go to restaurants if you don't have to be there, or bars, or whatever it is. So while there's a time limit, if you don't need to be at these places, go home, right? And it comes back to people being smart about this and staying away from crowded places if you don't have to be there.
Yes, sir. Thank you, Minister. Today we're joined by Ms. Rodney. She's from Nightly News. She has a few questions.
All right, Minister. I'd first like to ask whether there are any steps being taken to expedite the process to send more samples to CARFA to be tested, considering the Brazil worrying COVID-19 situation and even our local situation here. Over the last few days, we would have seen a 28-year-old died as a result of COVID-19. Now, I'm not sure if this person had any comorbidity or anything of that sort, but are steps being taken to send samples to CARFA or the Icon Medical School?
We have collected a set of samples that we like to send, but we have to make those arrangements. We haven't concluded making those arrangements as yet, but we are working on that.
Understood. We have about 3 different types of vaccines that are currently being used to inoculate the population. Can you say if any of them would protect persons against a COVID-19 variant?
As you rightly said, we have 3 vaccines. The first one being Sinopharm. We have the second one, which is AstraZeneca, and we have the third one now that we're using is Sputnik. In terms of how they work against variants, that's a pretty good question. What we know is that when these vaccines were tested during their clinical trials, the vaccines themselves have different level of efficacy. And so the Sinopharm one, as far as we're aware, it has an efficacy of about 79.4%. The AstraZeneca, once you have 3 months interval between first and second dose, the efficacy would be about 82%. And with the Sputnik, it's going to be about 91.2%. Now, in some of the trials that were done, depending on what variant, so some time ago, a couple months ago, there was a trial with AstraZeneca in South Africa. And in that particular trial, the South Africans said that the AstraZeneca was not very effective against that variant. And therefore, they did not continue using AstraZeneca in South Africa. Different places have had different experiences. AstraZeneca has continued to be used in the UK, for example, because their rollout has been using AstraZeneca. In Europe, they have been using AstraZeneca. In Brazil, they have been using AstraZeneca. So there have been different experiences. And what I will say is that with vaccines actually would help to prevent persons from getting the most severe form of the disease, which is very important. So while the vaccine would not give you 100% protection against infection, because with all the vaccines that are currently on the market, there's still a chance that you can get infected. But if you get infected, you will get a milder form of the disease. So, despite whatever variant it is, these vaccines still offer protection against the most severe form of the disease. And I think that is very important for people to note because once you're fully vaccinated, meaning that if it's a two-dose vaccine, you get both doses, about 7 days after the second dose, then it's considered that you're fully vaccinated. Then you will have protection against the most severe form of the disease. And I think that's what people should go for because I don't think anybody would want to get severely sick and have the possibility of dying. So that's what these vaccines do. They're protective against the severe form of the disease.
Understood. If I can add one more question, we would have received reports from various health centers, persons who are desirous of taking the vaccine, that the Sputnik vaccine is only being given to persons below 65, and the AstraZeneca is for persons above. Can you say whether this is true and why?
No, that's not true. Um, as you would know, we recently received the Sputnik. And,
Sorry, not a Sputnik. My apologies. The Sinopharm.
uh-huh.
Yeah.
The Sinopharm vaccine, what we have received in the instructions of the vaccine is that it should not be used in persons above 60. And the reason being, not that it's not effective, is that when they did the clinical trials, they did not have a large population of over 60 when it was tried. And while they have not prohibited the use of the thing in people above 60, they have said they don't have enough clinical data. And so their advisory was for us not to use it in that older population because they just don't have the clinical data. So we have been following those instructions of not allowing it to be used in people above 60. You would also see that there have been a debate with AstraZeneca as well. And that debate started some time ago, uh, whether or not to use AstraZeneca in people above 60. In the WHO has made a ruling that it can work, and in the SAGE meeting, the scientific meeting, they have agreed that the the um, the AstraZeneca can be used in persons 60 years and above. In Europe, there has been a debate about that, and more recently, uh, Germany has now, uh, having gotten the European approval, because in Europe as a whole, they have approved for AstraZeneca to be used for 60 years and above. But some countries are taking individual decisions now. So, Germany, for example, has said they're not going to be using it for people 60 years and above. And a couple of days ago, Canada has also said that they're not going to use it for 55 years and above. Now, why they have restricted the use, they haven't published those reasons, but I suspect it has to do with availability of clinical data in this population. But we'll see. The WHO is having a meeting today and tomorrow, and this topic of use in an older population, I'm sure, would come up in those discussions, and we'll await for their guidance to see whether they have changed from the original position that they had, where they have authorized the use of AstraZeneca for more than 60 years.
Minister Anthony, thank you so much for speaking with us.
Thank you very much.
Well, that's it for today's COVID-19 update. We've just spoken to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.